the Community Health and Healthy Aging Fund's CHIP process. My name is Jamia Tappan. I am the Director of Health Equity and Community Investment at Health Resources in Action, and I currently serve as the CHIP Program Officer. So I will take us through this presentation and then answer any questions you may have. My colleagues Albia and Chen Chen are also here to provide any additional context related to the broader RFP process. I don't know if you guys want to say hi or no. That's good. Okay. So the objectives for today are to really understand the funds CHIP process. So I'll take you through that and also share some examples of what a CHIP looks like, and then to answer any questions related to the CHIP and the broader funding opportunity. So the fund's purpose is to, or our vision is a Massachusetts where communities are transformed so that all residents have an equitable opportunity to have the highest quality of life possible. And our goals are really to think about how we can disrupt and remove barriers to health. So that's thinking about many structural and institutional challenges and areas of oppression, such as racism and power imbalances. And we try to disrupt these things through community-centered policy systems and environmental change approaches. The CHIP process really includes two key components. And for us, we're using the algorithm CHIP to include the entire process. So community health improvement process, which includes one, a community health assessment, and two, really implementation of that process. So a CHIP really uses a community health assessment to identify priority or issues. And this is developing and implementing strategies for action and establishing accountability to ensure measurable health improvement. And if you look to the left, you really see how we move along this process. We really like to center community engagement and having key stakeholders engaged in the process, residents, community leaders, and particularly folks that are often marginalized from the process. And so I think as you move along this loop, you might find yourself either just starting off in the process, or perhaps you've convened a group of people, you know, the community that you're focusing this assessment work on, and you're moving into data collection and prioritization. And perhaps you may also have a assessment already completed, and you're really trying to prioritize the data in that space, working with community, thinking about the strategic partnerships you need to make that really highlight those key issues. And then you're working on actually implementing an action plan. So using the data that you've collected to create priority issues, and then creating an action plan related to those issues. And then at the end, while you're implementing it, is really opportunity to evaluate and to reflect, and in the future to complete a new CHIP. What's really important here is that you have community engagement at the center, and along the entire process, you're thinking about ways to engage new folks, to reach folks that are often excluded from the process, and thinking about ways to really have a more inclusive and accessible engagement with residents. Next slide, please. The key components of a successful CHIP, some of which I've already mentioned, is a single, grounded, and collective process that incorporates health equity and social determinants of health. So within the framework, as you're moving along, is really thinking about how you are trying to disrupt inequities, and thinking about those systems and institutional challenges, and how they impact the work that you're trying to do. You want to have full and broad community engagement, clear, focused, and measurable objectives. And we do provide like assistance on developing that, because that can be challenging. You want to have clear definition and realistic outcomes within your action planning. And this really is keeping you on track, so you know, you can see the big picture. And then finally, plans that are fully integrated into the work of partner organizations. So particularly as you move from assessment into implementation, you want to make sure you're making partnerships in your community, with folks maybe doing work around those key issues. So for example, if you're doing housing, partnering with people doing housing, as well as the public health sector. Uh, and I think it's also important that when you are in that implementation phase, that your work is really focusing on policy and systems change work. And some other key components include strategies to support backbone organizations or the infrastructure and operations of collaboratives, as well as approaches to create awareness and build skills to address structural institutional racism and inequities, and strategies to support enhanced data collection and evaluation activities. Again, these are areas that we can provide some assistance on and really help us to inform the broader work that's happening in your communities, and really informs our larger evaluation practices. Sorry, you can go to the next one. I think this is the wrong slide. Yes, thank you. We'll go to this one. So one of our current awardees is the town of Randolph. And this is just an example of how you might take some challenges you're having in community to create an assessment and implementation process. So within Randolph, it's a community that is disproportionately affected by chronic disease. It's also one of 5 municipalities in Mass for which 100% of its census block groups meet at least one of the environmental justice population criteria, in which they have greater risk for environmental risks and burdens. And so it's really important for them to think about how they frame their community. So it's a Randolph community, right? And they already have identified some key challenges within their community. What's really interesting about Randolph is they had already kind of created a backbone space where they were able to work with community partners to sort of leverage a lot of planning work they had already been completing. And so with this backbone organization, they were able to sustain the coordination and capacity efforts for this chip. And some of that included multi-sector representation, trainings, collaboration, and sort of a lot of strategies that they use to help build that, to continue to build the momentum of the relationship amongst those multi-sector partnerships. They also really were sure to include a diverse range of populations, including priority identity groups. They engage key partnerships such as municipal leaders and school representation, as well as religious institutions and the business community. As they moved along into their implementation phase, they were able to really prioritize the key data points, including having a work plan and strategies related to environmental justice, and ensuring that those partnerships exemplified that key strategy to implement within their work plan. And we were also able to support them in creating shared metrics and a process for tracking that work. And so as they moved along, as they were able to move into implementation, that they had key partnerships, that they had a set of evaluation measures to think about how they continue to build those relationships, engage community, as well as meet the objectives outlined in their implementation plan. And the root causes, that the underlying root causes that they are also thinking about how to dismantle and disrupt include systemic racism, ageism, xenophobia, and poverty. We also, in addition to funding the CHIP process, we have resources for planning grants for CHIP. These funds will take applications from organizations that seek to move from short-term, time-limited efforts to long-term sustainable approaches. So within this grant framework, we'll be supporting some initial planning, technical assistance, and to better understand what a chip is and what approaches you might need to develop in order to move into the chip phase. So this could include things like what's the best approach for you, what's the best model to use, the best model to use for your chip, identifying what the community is, what are some of the challenges, as well as how you might move forward with creating an evaluation structure. What's also important is really building up that initial engagement with community so that you can move into the CHIP process of having residents, key stakeholders, and a diverse range of community partners engaged in the process. I just was going to read the last line of that because it might be helpful. Recipients of planning grants are welcome to apply for a full grant in the next funding cycle. However, funding is not automatically guaranteed for planning grantees. So you really want to think about where you are in your chip, how much capacity you have to complete a chip, and if it makes sense to apply for this initial grant before applying for a full grant, chip grant, or if you can start your chip in this grant period. So for the full grant, you can have up to $375,000 for 3 to 5 years. And then the planning grant is up to $50K for 1 to 2 years. So again, just clarifying, are you in the planning grant space, or are you do you have the capacity to move into a full grant, which includes starting that assessment and moving into implementation? And for this, I will kick it over to my colleagues.
Hi, everyone. Just very briefly, folks who have attended the webinar and some other office hours already know this information, but again, wanting to emphasize that the funding opportunity announcement was made last week. And so throughout from January on to March, we're going to continue in some application support spaces. So please be on the lookout for those office hours where you can come in and ask some additional questions and learn more around the funding opportunity. The application deadline is going to be March 29th, 11:59 p.m. Eastern Time. And the goal is to make announcements on who received the award in June. And the grant start date as of now is July 1st, 2024. And at this point, this is the applicant support calendar. And so these will be available. It's probably a little tough to see these, but the different office hours will be made available to you all on the website. And so this week we have PSE and healthy aging related office hours that will take place. And some additional office hours that will take place again come the following week and into into February and March. And so please check out the website for the calendar of support. And with that, please again, check out our website, and we're happy to take any questions that folks might have. Can stop recording now.